Well, welcome everybody to Noozhawk Talks. I'm Bill Macfadyen, the founder and publisher of Noozhawk, Santa Barbara County's leading source of local news. For almost a year, we've all been dealing with the coronavirus, the biggest public health crisis that Santa Barbara County, our country, and our world have faced in our lifetime. The health and economic consequences have reached into virtually every corner of our existence, and the results have been catastrophic for far too many. But Americans are nothing if not resilient, and we've responded accordingly, even though each of us too often feels as if we're playing catch up. And the truth is we are, and we will be for some time to come. As alarming, maddening, and bewildering as the unknowns of COVID-19 have been, the questions, uncertainties, and frustrations surrounding its vaccines seem to be worse. Since December, Noozhawk managing editor Gianna Magnoli began asking readers to send us your questions, and the response has been monstrous. She and her team have gamely organized and answered those questions, often multiple times, but we thought a webinar with some of Santa Barbara County's leading healthcare officials would be beneficial. So here we are. We're excited to welcome 1,030 of you to this webcast, which will tackle some of the more than 300 questions we've received since last week. Obviously, we can't get to all of them in the next 75 minutes, but our news team will follow up as soon as we can. And they're just now hearing about that for the first time. Oops. In addition to your questions, today's panelists will provide a brief review of COVID-19, a brief review of the vaccine rollout to date, the current situations within their organizations, and what's ahead for our community. This webinar is being recorded by our audiovisual team, Courtney Rintoul and Cheyenne Brooks of the Santa Barbara South Coast Chamber of Commerce, and a link will be sent to those of you who registered for it. Noozhawk staff writer Jade Martinez-Pogue is covering it, and the video will be embedded in her story later tonight. This would not be possible without the support of our title sponsors, Cottage Health and Sansum Clinic, our gold sponsors, the Santa Barbara Foundation and Santa Barbara Neighborhood Clinics, our silver sponsors, the Mosher Foundation and the Santa Barbara South Coast Chamber of Commerce, and our bronze sponsor, the Santa Barbara County Public Health Department. With that, on to our panel, featuring Cottage Health CEO Ron Werft, Dr. Lynn Fitzgibbons, an infectious disease specialist at Cottage Health, Dr. Kurt Ransohoff, CEO and Chief Medical Officer of Sansum Clinic, Dr. Charles Fenzi, CEO and Chief Medical Officer of Santa Barbara Neighborhood Clinics, and Santa Barbara County Public Health Director Vaughn Do-Reynoso. Thank you all very much for being here. So let me navigate back. For our coronavirus review, Vaughn, if I may call you by first names for this, I think it might be more conversational. Could you please provide a brief recap about COVID-19 in the last year?
Yes, more than happy to. And thank you for hosting and coordinating this valuable, critical town hall, Bill. So let me share my screen with you. Okay. So I'd like to start by doing a case status report. So since March 15th, when we received our first case in Santa Barbara County, it was March 15th, 2020. Since then, almost a year later, we have 30,090 community residents who have fully recovered. We unfortunately have experienced 381 deaths in our community. We have currently 596 active cases, and we currently have 104 community residents currently hospitalized. And so I want to point out that for a complete daily look at the pandemic situation in Santa Barbara, please visit our website and check out our community data dashboard. And so that is publichealthsbc.org. In addition to our case status, as you are aware, every Tuesday, the state issues a blueprint metrics. And this is our current blueprint metrics for our county. Our adjusted case rate is at 27, and that was adjusted from the raw number of 31.7. So the adjusted case rate is done based on the volume of tests that we conduct in our county. Our positivity rate is at 8.2, with the positivity rate in the health equity neighborhoods at 13.3. So these are really critical numbers for us to monitor, because this is what drives the tier when we are in the blueprint metrics tier system. Currently, I think I'll pause here, or would you like me to continue?
Why don't you go a little longer and then we'll get to Lynn.
Okay,
Thanks.
great. So currently in Santa Barbara County, we have an allocation from the state of California on a weekly basis. And the state of California, of course, receives their allocation from the federal government. With the weekly allocation, we distribute that to our community providers, about roughly 80%. And we keep about 19 to 20% at our community vaccination clinics. And together with our community providers, we together vaccinate all the eligible populations in our county. However, that will soon change. In several weeks, it's already happening in some counties, and we are in a later wave. So in several weeks, Blue Shield of California will be doing the allocation to our healthcare providers. So Blue Shield will receive the allocation straight from the state and distribute it to some of our partners, not all of our partners, some. And the Public Health Department will continue to receive our set allocation from the state. And we, in partnership, of course, will be vaccinating all of the eligible populations in our county. Here, I'd like to also mention that with the third-party administrator, we will also be launching a statewide initiative. It's actually a statewide mandate, My Turn. So this is a registration appointment system that all counties and all providers in every county who are offering vaccines will be on My Turn. So it provides a consistent way of determining eligibility as well as appointments. For those who are unable to use My Turn because of the technological barriers or Wi-Fi barriers, the state also has a call center, but we locally will have the 211 as well as our call center stood up to support community members when we launch My Turn, and anticipated in also several weeks. And the other information that I'd like to share is our vaccine distribution. So there's been a lot of questions. Is Santa Barbara County receiving our fair share of vaccines? And that is something that the Public Health Department monitors on a week-to-week basis. So this graph describes all of the counties and their allocation of vaccines this week. So we did receive a slight increase. We are going to be ordering 7,410. So when you look at the allocation for Santa Barbara County, what we did was to make sure that we were getting our fair share. So we did our per capita analysis, and we indeed are receiving our fair share according to per capita and the methodology that the state has put forth. And that ends my presentation for now.
Thanks, Vaughn. Lynn, could you speak to the kind of the development of the coronavirus over the or what we know about it now over the last year or so?
Absolutely. I think, I think at this point, I suspect that most of your readers, certainly every one of my fellow panelists, and I think the vast majority of our community have become junior virologists. And so I actually will open with a presumption that many of those listening could probably draw the viral life cycle as well as I could. With that as a background, I think I probably would favor focusing on maybe the 2 or 3 most important takeaways that I feel are kind of relevant right now in the context of this background. So clearly we live in a world with viruses. We have influenza that comes and goes every year. We have coronavirus, 4 human coronaviruses. Quite aside from our pandemic, coronavirus that we're dealing with right now, that really come through the population all the time. Interestingly, the other respiratory viruses have not come through our population with anywhere near the same vengeance as they usually do, because, I'm looking for my mask, because masks work. And everything that we've done to prevent SARS-CoV-2 from transmitting has, of course, had added advantage when we think about influenza, when we think about some of these other viruses. What does that mean looking forward, though? So, the reality is SARS-CoV-2 has really taken over as the dominant, important respiratory virus for our human population this year. That's a fact. Vaccines are going to help that tremendously. And I hope that, part of my framing of this is actually sincerely just an echoing of the critical work that Vaughn and her team are doing with the vaccine rollout. Because what we need to do with SARS-CoV-2, knowing just how, I would say, quickly it's become the dominant viral strain, we need to get it under control. I know we'll maybe touch on variants a little bit later, but just like we, know influenza, other coronaviruses, metapneumovirus, parainfluenza virus, I can be very boring on this. Just like all of these other things kind of come and go in cycles over a year or over years, one of the biggest concerns we have is that SARS-CoV-2 has certainly made itself known this year, but what is ahead? And I think that's, again, just an emphasis on how critical this vaccine effort is to mitigate the pandemic.
Okay, we appreciate that. And yes, I think all of us know way too much about this, but it's the more we know, the more we find ourselves needing to know. And I think that's one of the challenges that certainly Noozhawk has encountered just as much as you guys have. Ron Werft, could you give us a little bit of a recap on the administrative and institutional response that Cottage Health and other organizations are undertaking right now?
Yeah, I'd be happy to, Bill. First of all, thank you for putting this on. There's so much need for accurate current information, and we really appreciate you and Noozhawk for doing this. I think probably your viewers are more interested in where we're going than where we've been, but there are lessons from where we've been that I think are important. And so I am able to talk through the American Hospital Association to a lot of colleagues around the country. And having looked at the questions that came in for this panel discussion, these are going on in every community in the United States. And so we're in good company in that respect. For our community, I want to just make the point that all the work that was done by all the people on this panel and others, including the leadership at Marion Medical Center and Lompoc Valley Medical Center, all the work on PPE, on surge planning, on all of the effort over the last year really paid off for how we're going to tackle getting this community vaccinated. And the public health department can't do it by themselves. Cottage can't do it by ourselves. And it really is going to take a very effective collaboration, which is what we enjoy here in Santa Barbara. So where have we been quickly? I'll just speak for Cottage, but it really is representative of all the hospitals and Sansum Clinic and neighborhood clinics. We're all in this together and really dedicated to the same goal. But I'll use Cottage as an example. We began working on preparing for the vaccine around Thanksgiving. And on December 17th, it was a big day for us because the first shipment arrived on our loading dock. And within about 3 hours, we were putting vaccine in the arms of healthcare workers. So that was a very exciting day for us I know the community is very anxious to have that same enthusiasm, but for us, getting our healthcare workers who at that point had been working in and out of the COVID units nonstop for about 9 or 10 months at that time. And so it was really, really important for us. We have followed and continue to follow the eligibility requirements and rules that come from CDC, the California Department of Public Health, to Dr. Do-Reynoso and Dr. Ansorg. And so the initial rollout for us was for healthcare workers, and then that definition expanded from those who had direct patient care to those who came into the hospital, into this environment on a regular basis, to all physicians, to the office staff of physicians. And all of us were doing this. Kurt can certainly speak to this as well, but Sansum was not just providing this for healthcare workers associated with Sansum, but for others in the community. So again, we're all in this together. We learned from the 4 weeks of doing that, things that we might be able to do better as we prepared for a community clinic. And so we have set up a community drive-up clinic. Everybody's doing this a little bit differently. We chose to do this with cars. And so on Hollister and Patterson, we opened on January 15th. For 2 days a week, we were providing 500 vaccines to those who were 75 or older and healthcare workers originally. And so that scaled up to 750 2 days a week the next week, and then 1,000, and then 1,250. And now we're in our 6th week of this, and we're providing 1,500 vaccines 2 days a week, which isn't nearly enough. And so what did we learn from this? We learned about supply chain. We learned how to avoid waste and make sure we had a waiting list there at 4 o'clock so that we wouldn't waste a single dose of vaccine. We learned about scheduling. We made some mistakes early on by using MyChart to get to a limited, just a starting point on this. We learned in a day not to do that. And so we learned a lot. We've given now over 8,000 or almost 8,000 first and second doses to those who were eligible for Santa Barbara Cottage Hospital, primarily healthcare community. And we've given out more than that, but over 9,000 at our drive-up clinic at Goleta Valley Cottage Hospital. I would quickly add that Marion Medical Center has done the same thing. They used a different approach. They used more of a tent and walk-in approach. Sansum has been doing this from the very beginning, and Lompoc Valley Medical Center, same thing. All of us taking a little bit different approach, but it's what's worked for us. I think I'll stop there, and then we can cover more about the Goleta Clinic, maybe with future questions.
Thanks, Ron. Kurt Ransohoff. Sansum seems to have a much more laser-focused approach to vaccinations from my perspective. How have you all encountered any limitations with that, and what are your short and long-term plans to serve your patients?
Well, first of all, like everybody else, I'd like to thank you, Bill, for getting this group together. It seems like, just judging from the questions, there are a lot of them and a lot of participants. You know, before answering your question, I would like to just reflect on, I think, something that is pretty unique in this community, and that is the cooperation amongst the entities here. You know, when I hear Lynn speak, I think, you know, she's speaking for all the doctors and for Sansum and for the public health department and everybody. And we really have had a very collaborative approach. Along those lines, when we think about who gets vaccinated, it doesn't matter which entity vaccinates you. You know, whether you get the shot from the public health department or from Cottage or neighborhood clinics or Sansum or a pharmacy, it works the same. And I think that's really important. In terms of your question, Bill, yeah, we have been a little bit more laser focused, I guess, because we have a very intimate relationship with our patients, and we just have a very large number of them. So a lot of people, you know, say, I want to get the vaccine from you or from us. And, you know, we try to say, you should get it from whoever you can get it from. And that, I think, is really a take-home message. To give you an idea, we just opened up our 65 and over a couple of days ago. We have 18,000 people in that bucket. So now those people they're also in they're on Ron's waiting list, and they're on Ralph's waiting list, and that's all good. But so we have tried, because they exist in all of those people exist in our electronic medical record, we are actually trying. It's funny when Ron said they're moved away from that, and I understand why you did. For us, because they exist in our EMR, we are trying to do it through our EMR. So it's a little different the way we do it. What the future holds, we look forward to the day when we will not be constrained by the supply. When that happens, there's going to be some day up ahead where I think that there'll be enough supply where we can think about collaborating more than we even do now. I think Cottage's site has the potential to do the highest volume. We are doing it at nights and on weekends in an empty building. You need a lot of space because people need to be separated, and you can't have your regular activities going on. So we don't have an empty building. So we're doing it at nights and on the weekends. We can do about 60 an hour when in that setting, which is pretty good. It's not as many as can be done at the Goleta site though, because again, just so much more room. So I'll stop, but major take-home message is wherever you get it, it's all good. It works the same, and we really are cooperating. You'll probably see we put the other places where you can sign up on our website to let people know you don't have to wait to get it from us. Get it from whomever you can.
Okay, thank you. Chuck, neighborhood clinics typically serves an underserved population on the South Coast. What are you doing to reach out to your patients, and are you able to get sufficient vaccine doses for them?
Chuck, you're muted.
I'm glad I'm not the only one who does that.
Thank you very much for putting this together. This was great. Yeah, so we heard late in December that we were going to get our allotment of vaccines. And we started right off on the 2nd of January getting our own staff vaccinated. So they got their first doses. And then we've held clinics every weekend since then, more or less, ranging from 40 to 300 that we've done in a single day. And we have refined our approach. This is all using our own staff. Basically, we've had a handful of volunteers, but this is our own staff doing that. So our staff will spend the week calling people on our list based on the eligibility requirements that both Kurt and Ron have talked about, and get them on a appointment list and with times that they can come. And so that has been actually quite enlightening to me. I was expecting a great deal of vaccine hesitancy amongst the population that we serve. And to the contrary, there's a ton of excitement and maybe some frustration about why is it taking so long for you to get to my place on the list. But we've given 750 doses so far, and we've completed the second doses for our staff. We've reached out to some of our partners. We've done Planned Parenthood staff as well, along with their second doses. We've done C International, and we have done domestic violence solutions as well. And we are concentrating on now that the 65 and older are eligible. That's what we're working on this week. I'll stop there, but many of the other things that we're doing, I can probably answer during the question session.
Great, thank you very much. So let's just jump into those questions. For our listeners, our viewers, we divided this up into 4 broad categories: the vaccine itself, the prioritization of the administration, the process that goes into this, and then what the future holds. So and I tried to consolidated a lot of the questions. Obviously, as I mentioned earlier, we can't get to all 300 today, and you guys have been putting some tremendous ones in the chat, and I appreciate that. We will get to those. Noozhawk will get to those if we can't answer them today, but we're going to make a stab at many of these. Vaughn and Ron, the supply and the distribution, you talked about what we're seeing now, but can you speak to the federal, state, and local future with as more of these vaccines are made, as more come online? The Johnson & Johnson vaccine is out there as well. And can you maybe address how we're going to be alleviating some of this bottleneck?
Sure, I can start, Ron, if that's okay.
Thank you.
So we know that we've been hampered by the scarcity of vaccines. However, with the new federal administration, I'm very hopeful. Just in a couple of weeks, we've seen our allocation eking up in the right way. We are getting additional vaccines. As I mentioned, we are getting about a 34% from last week. In addition to that, we have seen pharmacies directly in a federal partnership with the feds, and that is CVS and Rite Aid in North County. And I was really thrilled last week when our 5 community health centers run and operated by our public health department got notice that we will be, that we can count on at least 500 additional doses on a weekly basis. That's tremendous. We have not heard of a guaranteed set allocation prior to this notification. So I think that as we see the availability of vaccines come on the federal level, our county will definitely be in receipt of more vaccines, and thereby alleviating the bottleneck and the scarcity. Every one vaccine dose that we get is one more that we didn't have before. So I'm thrilled that the federal partnerships are expanding through the pharmacies, through the community health centers, as well as the state expansion of vaccines.
Yeah,
Thank you.
Bill, I would only add that I think one of the things that is very challenging for Vaughn and the Public Health Department and for all of us who are joining her in the effort is we just haven't had the level of transparency and predictability that we find out, and just using us as an example, because we're in literally daily communication on this. We find out on Thursday how much vaccine we will get on Monday for clinics we're providing that week. And so it takes about 100 people to operate a vaccine clinic like we're doing. And so the logistics of that are very, very challenging. So we're in direct discussions with, through the American Hospital Association, with Andy Slavitt on this issue. He's committed and is actually listing exactly how much over the next 3 weeks is going to every state. And now we work with Sacramento to, in collaboration with Vaughn and her team, on making sure that we can get that level of predictability here. I would say it's another question later on, but I think this might be a good point to just mention the transition to Blue Shield. And it's no reflection on really anybody in the current system, but they are going to be contracting with vaccinating organizations that that they feel are able to get a lot of vaccine out. And I think that I'm hopeful that one of the benefits of that will be that Santa Barbara County is able to get a higher dose as it becomes more available. But it remains to be seen, but I'm hopeful that that will take place.
Right.
Okay. Thank you.
And I think the other piece is that, so as Kurt and Ron and Chuck and Lynn have alluded to, we're all in this together, and the partnership that we have built, we have the infrastructure in place. We're just waiting for sufficient vaccines. We all built the capacity and the infrastructure. So I think as soon as we get that that volume of vaccines, we can roll it out quickly.
to that point, just at our site, and we're not the only vaccinator, but just at our site, we know today we can do 2,000 vaccines a day, 2 days a week, and that's all the vaccine we have. We only have enough vaccine for 750 doses next week for people to get their first dose out of 41,000 people who are between 65 and 74 in the county. And so our goal, when we get enough vaccine coming in, is, and we'll just be one of the sites, is to do 2,000 doses a day, 6 days a week at that site. And we know what it takes to do that, and we're very confident we can. We just need the vaccine.
Right.
Yeah, it's amazing how quickly that adds up. So speaking of the vaccine, though, and the distribution of it, Noozhawk reported on the weather delays. We've all seen the news out of Texas and the South, and the impact that that's had on the vaccine distribution. Chuck, is there anything more recent on that? Any updates?
Well, I certainly feel very, very fortunate that I'm in one of the very few counties in the entire country where they're not wearing their parkas, particularly down in the area where I used to live, where it's really cold. So I was asked that question this morning, and what we've discovered, unfortunately, we have enough vaccines stored that we can get through this weekend. We're planning to vaccinate 220 people this weekend at our Saturday clinic, but we're not sure we're going to get enough vaccines for our next week's study setting on the 6th of March. So we'll have to see what happens. We'll have some left over, but we're hoping we'll get more. And I think that's particularly related to the storm, to the cold.
Right. And then how is that going to have what effect will that have on second doses that are in the pipeline?
So the good news is that these doses that we're doing, we did our last one, and this one we're doing this weekend, our second doses.
Oh, okay.
And so we should catch up with the second doses.
Great.
It's a bad sign when you're checking the weather in Memphis to figure out what you're doing next week, which actually I was doing earlier today. It's going to be above freezing, I think, starting tomorrow. So we did not get just like everybody here, I'm sure, didn't get their weekly allotment. So we're still waiting for that weekly allotment. Like Chuck, we're going to do about 700, I think, on a Saturday, and then we will pretty much be out. So there should be that this week's allotment, we hope, will arrive by Monday. But it gives you a sense, Bill, of the dilemma we all face, because we want to get it into the arms of people. And as we've already seen, the weekly supply meets about a sixth of the current. And that's before you start expanding into the other worthy people who are waiting, anxiously waiting. So, so we're all, I think, trying to make sure we give out as much as we can, and yet at the same time need to be sure that we can provide the second doses that we've given. And we should be able to, although this weather thing has kind of certainly thrown a
Bill, can I just reflect on, I think I just realized I'm the layperson on this panel surrounded by execs. What we're hearing is the systems have been put in place around our county, and every one of these systems from the health department down, and they're so robust, and they are vaccinating thousands and thousands of people, and they are so fragile. It's like eggshells. Day over day, they don't know how many vaccines they can give out. And so, again, part of why I point out that I'm the layperson here is, and I tease, we all take these calls from friends and family, but the frustration that I sympathize with, that people they had a first dose, they don't know when they're getting their second dose. It's 6 days before that second dose is due. That's incredibly anxiety provoking for my family, for my friends. But just to hear, I think, our leaders here explain the background of what's really going on behind the scenes. And also, I think that it strikes me just how remarkable and how successful I think the systems have been, even in that context.
Mm-hmm.
Right. So we've had to cancel our public vaccination sites, and Lynn, thank you for saying those words, because you're absolutely right. Just quickly, as soon as we sent out the cancellation notice, we received a lot of worries. And I want to share a really happy story, because I got a call from a community member saying my mom's appointment that we worked so hard to get got canceled. What is this all about? And I shared that it was weather related, that it was not due to vaccine shortage, and did some reassuring. And last night received a text that said how wonderful. Not only did we get 3 notifications that said the appointment was canceled, but we got the 4th one saying your appointment has been rescheduled for the following week. So that just, we work really hard to reassure our community members when the unexpected happened. And you're absolutely right, Lynn, in characterizing it is a fragile system when you're at the mercy of the weather and the federal government and the state government for the number of vaccines on a weekly basis.
So Vaughn, that brings up a question, you know, of the people who are waiting for their second vaccination, how concerned are you, or how many people do you think that affects, that this particular disruption that you know should be resolved in a matter of days, you know, will they have to start all over again?
No. So we have already rescheduled the canceled appointments, and we are reassured because we checked in with all of our hospital providers and our clinic system, and everyone is set for this week, and we anticipate the weather to be resolved. So it's really our public health clinics that we rescheduled, and we've done that. So what it means, bottom line, is that we will just work harder next week to ensure that our community members waiting for their second dose will get it in time.
Great, that's reassuring.
And we know today that we'll have sufficient supply next week for all second doses. And for those who are, there's a question posed for those who are worried that they haven't heard about scheduling it yet. I hope the sequencing here helped explain that. We don't want to schedule it unless we know we have the vaccine, and we will reach out to you. If you receive that first dose from us, we will reach out to you and tell you when to come for your second dose.
And Bill, may I just answer the question more generally? Because this week's weather delay was one bump in the road, but there may well be more. And I think this is actually, from a clinical perspective, a really critical point. The studies that were done with the 2 mRNA vaccines that are currently authorized under an EUA, the Pfizer and the Moderna, these vaccines were studied in a big set of clinical trials with a prescribed, delta, a prescribed difference between these 2 doses, 3 weeks or 4 weeks respectively. There is no reason to believe that a little bit less or a little bit longer or even quite a bit longer is going to decrease someone's immune response. From a public health perspective, we absolutely want to stay aligned and strive to meet what was done in the clinical trials, to replicate that. But to your good question, which comes up all the time, do I need to start at the beginning if X number of weeks has passed? The answer is emphatically no. And it may well be that in a year's time, we tell everyone that, as the United Kingdom is doing, spreading it apart, perhaps there's some data a year from now that says that that may be preferable for some reason. And so I think, just to reiterate, I think everyone's point, these systems are working their very hardest to get everyone vaccinated with the right, duration between the 2 doses. Please do follow the guidance of your physician and the public health officials, but also don't be too dismayed if you get off schedule a little bit. The vaccines are still going to work.
Okay, thank you. And what about that's a good segue for the Johnson & Johnson vaccine, which is, I believe, being under FDA review next week. And that's a single dose, I think, right?
Correct.
Yeah, so the Johnson & Johnson vaccine is a new type of vaccine for this virus. This is going to be called a viral vector vaccine. Instead of giving the mRNA, which is what the current 2 vaccines do, and then teach your own cells how to make the protein, the spike protein, and then how to fight it, which is basically how the mRNA vaccines work. The Johnson & Johnson vaccine is different. It's actually a more conventional approach where you inject a virus, a type of adenovirus that doesn't replicate within humans, the type of virus that we're exposed to often. But within that virus, we're putting a little code for the spike protein. It's just another way to kind of, just like the mRNA virus or vaccines do, we're sneaking in the code, the recipe for the spike protein. We're just using what's called an adenovirus or a viral vector vaccine. The reason this is so important, and I belabor the virology point, is that it is exactly this that makes it much easier to store. And that's why this J&J vaccine is really being touted as very promising for harder to reach places, because while it can be frozen for 2 years, it can be fine. It can be stored absolutely fine for up to 3 months in a refrigerator, essentially. In addition, it was only studied as a single dose. It wasn't studied as a double dose. And so the single dose data looks in the United States to be about 70 to 80% in that kind of range. And there was some difference when they looked at and it's so good that they did this, but when they looked at a place like South Africa that has perhaps a slightly different version of the virus circulating right now. The good news is, even in South Africa and Latin America and the United States, the J&J efficacy, how well it worked, was really very good. Unfortunately, we as a public, me as an ID doc, I now expect 95% for all my vaccines. The reality is, most vaccines have never worked that well. Most vaccines work perhaps 40 to 60% efficacy. And that's still very beneficial from a population health perspective to protect someone and protect spread. So the J&J vaccine, I think, as you said, we're going to see an FDA meeting on the 26th. We anticipate it should receive EUA. There's nothing to suggest that it won't. And one of the challenges is going to be finding its niche, and perhaps some anticipated concern, I think, from people that perhaps 72%, albeit a one-dose vaccine, is that actually inferior to 94%?
Oh, I see.
Lynn, you have totally lost your claim to being the lay person on the panel. But just to echo Lynn's comment, I do think that it's really important that people understand that most vaccines that we take are nowhere near as effective as the ones that have been coming out for this particular illness. And I think a question came across, can I choose which vaccine I get? Not really. I mean, I suppose you could shop around and figure out, who's giving what, but typically a place gives a vaccine on a day, or more typically, it might give, that is the vaccine that they give entirely. I do wonder if the Johnson & Johnson vaccine will be the kind of vaccine that could ultimately be given at the time of an office visit. Mm-hmm. Because the lack of anaphylaxis, even though anaphylaxis in the mRNA vaccines is very, very rare, the worry about it causes all of these efforts at such a complicated administration. And that J vaccine may be the kind of vaccine, like just when you go to your doctor for a flu, for an office visit in the fall, the doctor may say, hey, do you want your flu shot right now? Maybe maybe we'll wind up there. I hope so, actually.
I'm really excited from a public health perspective. After Blue Shield comes to town as our third-party administrator, the public health department will be charged with ensuring that the safety net population, the hard to reach, the hard to serve population will get equal shot at getting the vaccine. I'm excited because the one dose will offer us more options for the hard to reach populations, like the homeless, like the mobile, different work sectors who are more mobile than stationary in our county. So it's going to open up our range of options for all members of our county.
That's really a critical point. And Lynn mentioned this, but it's just to emphasize, it's a potential positive game changer. When you look at Bond's numbers of 7,400 doses coming to the county, and you think that half or more of those could be for second doses, we're just able to scratch the surface now. If we can give a large percentage of single dose vaccines, that is going to really boost our ability to get the county vaccinated.
Right. Hey, Kurt, could you discuss, once you've been vaccinated, what that means? Can you, go to a restaurant? Can you have family over? Do you still need to wear a mask? All that those kinds of questions. Can you briefly discuss, answer?
I'm sure I can, because there's probably no actual right answer to this.
True.
It's going to be hard to go wrong, probably. But, you know, I think that I get asked that a lot. That the other day somebody asked me, can they go fly on an airplane to visit their family in Maine? And, you know, that's a tough one, because I don't know that there's science behind that. I think that most of us would say, you still need to wear a mask. You still need to be careful, because the vaccines are not 100%. And also, you have the ability potentially, or we think, possibly to be able to transmit it and not get sick. But at the same token, you know, my daughter, was funny the other day, I mentioned this, and she said, well, what are we doing all of this if you're not going to be able to do anything? And, you know, that's another perspective. So I do think after people are vaccinated that they can lighten up a little bit. But it doesn't mean that we can just suddenly do everything that we want to or that we used to. There'll be a time, I certainly hope, that when enough of the population is vaccinated, it can go a lot closer to normal than now. But I think the answer is it's going to be an evolutionary process and not a revolutionary process. It's not,
Right.
you know, I got my vaccine and now, you know, I'm burning my masks. I don't think that's what's going to happen at all.
Yeah, no, that's a fair point.
This will allow us to get more data as we move forward to see whether or not you're infectious, and you still protect your partners and your neighbors by wearing your mask and washing your hands and staying apart. That's what I'm telling our folks.
Yeah, that's wise advice. Let's move on to the prioritization, and specifically what's in the news, you know, this week really is the presence of teachers on that priority list. Vaughn, this is probably your question, since you're probably working most closely with the state. What can you tell us about that, and what can we look for as a community?
I think that, again, based upon the new infusion of vaccines to our state and new methodology on how that allocation comes to our county, I expect that very shortly, we will be able to expand to childcare and education, along with food and ag, and along with emergency service workers. So we're talking about perhaps even as soon as next week. So it's a very fluid, and I do want to underscore that it's a very fluid situation with the increase in vaccines and the additional guidance from the state, and the movement towards the third-party administrator and my turn. But I do want to say that from the get-go, we in public health have realized the importance of maintaining safe schools. And so we stood up specifically a school team comprised of 15 leaders. 3 of them are physicians, with one of them being a pediatrician. We have EPI on the team. We have health educators on the team. So we have been working in close partnership with the schools, ensuring that they have the tools that they need to reopen the schools in a safe manner.
Mm-hmm. Okay, I'm not sure that's going to resolve anybody's questions. It's such a hot button issue right now. I appreciate the clarification. Go ahead, Chuck.
Well, the question I was asked just recently was, well, so now you've got 2 different kinds of teachers. You've got some who are exclusively doing 2-dimensional teaching, and you've got some who have all throughout the pandemic been face-to-face with their students. And should they be treated differently, was the question that we were asked. And that's, I don't have an answer to that. I don't know how that works. It would seem to me, just from a intuitive point of view, that the people who are closest at risk should have priority. But that's a banned question.
It's a really tough question, right? I mean, you're talking about prioritization among very, very critical essential workers, our teachers. I think if I was queen of the universe, I would vaccinate every teacher and every support staff who are supporting the teachers. I mean, that is our goal. Unfortunately, reality is that we are not getting enough vaccines. I think, though, while it makes sense to, and many of you on the panel lived through this. Originally, when we had only so much vaccines, we prioritized which healthcare worker would get vaccinated. So we were looking at outward facing, patient facing on 3 days or more to get vaccinated. So in that sense, Chuck, it makes sense for us to look at vaccinating teachers who are already having a lot of interaction with teachers. But then I also want to look at it from an equity lens. A lot of the schools that have opened are smaller, are private. So I'm worried that the larger schools that haven't been open, that if we prioritize, we take that into consideration as well, that we look at the public schools, especially in the health equity neighborhoods, to make sure that they also are prioritized in getting the vaccine. So the takeaway is, darn it, we don't have enough vaccines, so how are we going to manage this situation? So what it means is that we're going to have a lot of conversations with our education partners and together with our healthcare partners on how we as a community can be ethically and can be intentional in moving forward, all while there are the ag workers, also very critical, our essential workers, also very critical. So those are really the competing priorities that we have to grapple with.
And
Well,
Bill,
yeah.
could I just add that from an infectious disease perspective, my suggestion is to actually look 2 months ahead from now and be perhaps a little bit less myopic about this next week or two. And so what I mean by that is 2 months from now, I just have so much faith in Vaughn's team, Superintendent Salcido's team, our healthcare partners on this call and others. 2 months from now, we are going to have, I so hope, schools open. We are not, no matter what happens, we are not going to have 100% of staff on those sites vaccinated. But exactly as Vaughn said, I think so many of us so desperately hope that in the immediate, very near future, we are moving in that direction, that we are starting that process of getting teachers, other essential workers vaccinated really ASAP, but also remembering 2 months from now, this virus is still here. We are still going to have the need for everything else. We are not going to have universal vaccination, but as soon as possible, we need to be moving in that direction. That's my editorial, I suppose.
Well, sure. I mean, it is a math problem. You're going to have more people vaccinated. You're going to have more vaccine available. So it stands to reason that you're going to be, at some point, you're going to hit the tipping point and you're going to really start to make some significant progress.
And I think going along with Lynn's comments is the fact that all of us have plans to expand our delivery system. We certainly have a robust plan that's ready to go whenever we have more vaccine.
Right.
I think the last point I want to make is that I am encouraged by recent CDC policy statements based on research, based on other schools reopening, that you can reopen schools with personal safety precaution, with environmental safety precautions, that while we wait for universal vaccination, we can reopen schools safely.
Right. And there has, I don't think of the schools that have opened, been open in Santa Barbara County since October, I think there's very few cases that have arisen from that.
That is correct.
Right.
Along those same lines, if there's more people are vaccinated, there's more opportunity for to spread the vaccine. Would those tiers continue to be revised, or would or would you just stick to the plan? And the expectation is that we'll be able to get through this particular tier very fast because we've just got more availability.
Right. So we are looking at, with the increase in vaccines, the expansion towards the 3 additional sectors that I mentioned. And in addition to that, what I hear from the state is that beyond the 65 and the 3 sectors, which covers food and ag and childcare and education and emergency services workers, beyond these 4 groups, the state is working on guidance that is age-based. And so that will be the next expansion with the state's guidance.
Okay.
I might just mention as well that Blue Shield, in working with the state, is also planning on using equity as a part of the algorithm, which means that the better job we all do partnering with each other to get vulnerable communities vaccinated, the more vaccine we're going to get in Santa Barbara County. So we work very closely with Chuck and with everybody on this. We have a number of Santa Barbara neighborhood clinic patients who are scheduled to come to our clinic next week, or this week, maybe, Chuck, I've forgotten which.
Yeah, both.
Yeah, and so that's really important. And I have yet to talk to somebody who didn't have a very strong case as to why they should be in a category that's getting vaccinated right now. It's just, as you said, it's a function of math. It's a problem that is terrible to have, but it's only because of this extremely scarce supply.
Mm-hmm. Well, speaking of that, let's talk about Dodger Stadium, Bakersfield, going out of state, going elsewhere in Southern California, and searching for the vaccine. How is that? Can somebody please explain that? We get a lot of questions about that, and I'm surprised at how many people I know have gone to Dodger Stadium.
Same here. The only point
Yes.
I would make is I think it demonstrates how strongly people want to get vaccinated, and that's totally understandable. So if they're able to drive to Dodger Stadium and get a vaccine, they're going to do it, and should, I would say. The only issue I would raise is that for those of us providing vaccines here in Santa Barbara County, we get a lot of requests from those who got their first vaccine somewhere else to schedule their second vaccine next Thursday, because that's day 21.
Right.
Mm-hmm.
And so unfortunately, I have to say that if you received a vaccine somewhere else, or you're planning on doing that, you can go ahead and register on any of our systems. We can't guarantee that your name will come up when on exactly that 3-week point. And so there's certainly, I would encourage people to do that, get in the system, as many as you can. But the reality is that we just can't guarantee that it'll be on that 3-week mark, which, as we've learned and it has been said, is, I think, less important than we thought 2 months ago.
Right.
Mm-hmm.
That does cause a great stressor, because Ron, I also get quite a few emails, people who are coming up on their 21 or 28 days and are unable or unwilling, or circumstances change. They don't want to drive to Dodgers. They don't want to drive to Disneyland, and are stuck because we all have second doses tied to the first doses that we've given. So it gets into a very anxiety space.
Yeah.
I have been pointing out, I have the same issues pretty continuously, and I do always point out that wherever they got the first one, somebody has sent a second one to that place for them.
Right.
And as much of a hassle as it is, a lot of these people were so resourceful that they were able to get something that they couldn't get here. And most people understand, but it's a conversation always.
Well, the question I have then is, going back to one of Vaughn's very first slides, when, the Los Angeles County was, 5 times as large as the next county below. It just makes me wonder why the state is not reallocating some of that Los Angeles County vaccine to other counties. I mean, because can't be that many Santa Barbara residents going down to Dodger Stadium, but if they could send us 1,000 more, that would sure make a big difference. All right, nobody's touching that. All right.
The government,
It would.
That's
We
fine.
agree.
I think we all agree.
All
I
right.
think the state is tired of me sending them emails every other day about, hey, can we get this? Hey, can we add that? So I'm not going to touch that one.
That's
Vaughn,
all right.
I don't want to put Vaughn on the spot. So Vaughn, tell me that I'm misunderstanding, but my understanding was that in the next perhaps few weeks, there are perhaps different pipelines coming with regards to the state and Blue Shield, but there's also, of course, this distinct federal effort.
Correct.
And how that's going to play out with these mass, a location like Los Angeles County with, tens of millions of people, the impact that that's going to have on the allocations on the state level, as I understand it, is yet to really be explained or determined, but hopefully that'll be considered. If the federal government is providing a massive bolus to a county, that some of that could be redistributed.
Yes and no. So the state's allocation is based upon currently the demographics, the number of 65 plus that you have, the number of workers that you have in the 3 sectors that you're supposed to be moving towards. So that's one side. The state's allocation is based upon equity. It's based upon what your safety net population is. And so unfortunately, the two don't necessarily talk. So that's complicated. But I think that we are mindful until Blue Shield come and takes over the allocation. We are mindful about if a provider has a federal partnership and they're limited by their capacity, then that just gives us the bandwidth to shift that state allocation to another provider that is not in a federal partnership. So we have that flexibility at least for 2 to 3 weeks to come.
Got it. Thanks.
Okay. I want to ask about the homebound. My mother-in-law is homebound. She no longer lives in California, but what is the process to reach those people? How does that work?
I don't think that works very well right now.
That's true.
And some of it is bureaucratic. When you sign up, you're signing up to give vaccine at a certain site. And if you don't give it at the site that you said you give it at, you're breaking the rules. So that's one thing. 2 is you do have this anaphylaxis issue, which is rare. And it's interesting because now I think we're seeing that it's like 1 in 200,000 to 1 in 400,000. So it's actually quite rare, but it's there and it's known. And so now you're thinking about going out and breaking the rules that you agreed to vaccinate somebody who has a tiny little chance of getting anaphylaxis. But if they get anaphylaxis at home, that's not going to be good. And so it's for those reasons, I think, Bill, that the answer to the question is it's not happening very well. I don't know if that will change. And maybe that may be another Johnson & Johnson kind of opportunity, because again, you won't have the anaphylaxis issue to deal with, and the refrigeration and all.
Right.
But right now, that's a tough one. I don't know if Chuck or Ron or Vaughn, you have any better answer for that one.
well, so we're looking at that right now in terms of some of the retirement facilities that the county runs. And they actually have areas that we could set up clinics in and run clinics very much like we're doing at the Lucuba Junior High. So just that whole infrastructure and plant it there and do one at a time. Right, the Johnson & Johnson would be perfect for that. You just go back there one time.
Right.
Our population health team is working now on a proposal to try to expand access possibly through churches, through neighborhood sites, to augment what Dr. Fenzi is able to do at his clinics. We have a parish nurse program, and we have staff who might be very helpful in that. We do see we've had a lot of people, of very senior citizens find a way to get to the Hollister-Patterson drive-thru.
I've seen those pictures.
Yeah,
I know some of those people.
Yeah. So what we're doing in public health is that we are planning to do mobile units in senior housing projects, in neighborhoods, in health equity metric areas. So with the mobile units, in partnership with some of our volunteers and some of our community providers, we're hoping that that will at least make a dent into populations that have access and functional needs issues.
Thank you. Appreciate that. And then I guess the next segue there would be the role of just regular primary care physicians. We talked about that a little earlier in the webinar, but what do you realistically expect that to happen when this is truly like a flu shot? You know, you just go in and everybody has it. Is that totally dependent on Blue Shield? Is that totally dependent on the J&J vaccine, or?
Right. I mean, there's no plan for that at the moment, but that's, I think, I'm sure the physicians will all agree here that that's absolutely where we need to get. But we're not close to that now. The direction is to go through institutional providers and have us find ways to get into these vulnerable communities through partnerships. I can tell you that the primary care physicians and others will speak to this are very anxious to be part of the solution and to have that capability. And so they very much want to be an important provider here, as they are in every other respect. But the system isn't supporting that right now, and I haven't heard of any plans to do so.
Okay.
I think it's going to be interesting to see if the anaphylaxis warning sticks, or how long it sticks for, because now that there's more data about the fact that it is really 1 in every couple 100,000, whether that will continue to be to continue to persist, or if that'll change. And that's a really complicated decision that'll be made probably by the CDC, I suspect.
Mm-hmm.
I think that's, I mean, I'll just echo, Kurt, I think that that's an incredibly important point. This is kind of happening without us paying much attention to it, but we have vaccinated as a country between 40 and 45 million people with a vaccine that, yes, the science has been there for 10, 15 years, but was new. And yet we have had tremendous success with regards to, you know, a general paucity or general, you know, absence of severe side effects. I mean, it's really, really been remarkable.
I know, I think it's worth it. That's a good point, Lynn. I think it's worth just reflecting on that for a second. You know, we're having a discussion about how difficult it is to have the vaccine, to distribute this incredibly effective vaccine. I think in last March, if you had asked most people, next February, are you going to be having a discussion about how to allocate something that is safe and 95% effective, and the one that you're thinking isn't that great is 85% effective? You know, I think most people would have said, that's not going to happen, you know, and so right. I know we're talking about all the difficulties of the situation, and there are lots of them, but we should think about the fact that
we may have some more data, Kurt, to that point, on the 2 mRNA viruses and how effective they are at 1 dose.
Yeah. I mean,
that might change the game as well.
Yeah, you know, the previous vaccine that came out the fastest was mumps, and that was 4 years. Right. And that's an incredibly interesting story itself. But so, you know, this is really remarkable. It's just a shame there's not more of it. It's so remarkable.
Yeah, well, it's one of those things. The positives are really important to remember. And I think, you know, we're pretty much out of time here. I want to thank the panelists, but I do want to go around with the group and just focus on some of the positive things that you see the public doing. You know, there's a lot of talk and criticism about the public not masking or social distancing, but the fact is that most of us are following these rules, and I think we're playing a fairly significant, definitely not an insignificant role in getting control of the situation. And so, you know, from your perspectives, what are you guys seeing that we're doing correctly?
Well, I would say there's been no Super Bowl spreader event in Santa Barbara, so our community is doing a great job at following Dr. Ansarg and Vaughn's and Lynn's guidance on this. And that is definitely showing up in our statistics at the hospital. we're down 60% from our inpatient COVID census from this third wave that hit us right after the holidays. And so everything's going in the right direction. The first week in January, we look at the 7-day trailing positive test results as a leading indicator. And that number in early January was just under 18%. And today it's just over 5%. So I think that's that tells us we can expect to see that number of patients with COVID continue to come down. And frankly, it's totally because of about community behavior and people following the guidance, wearing masks, staying in their small family or very close pods, and being safe. And so that's what is going to that's what it's going to drive this. I also just want to thank, we had over 1,100 people volunteer to work at our clinic sites. And I know that's true for others as well. And so this community is just unbelievable. And so that's how we're going to get this done.
Yeah, our experience is the same in terms of people wanting to volunteer to do this. It's great.
Right.
You know, just to echo the social responsibility that people are showing, and also people I think are being pretty good at, they're frustrated, and I hope that everybody who's watching this understands we're frustrated too, all of us. We're all doing the absolute best we can, and we really appreciate the people understanding just what a complicated problem it is, and we are really trying to address it as quickly as possible.
Yeah, I want to underscore that. I think that what we are doing right as a community is reflected in the decreasing case rates and the decreasing testing positivity. And only when those things continue to decrease will we move out of the purple tier and into the next tier, the red tier. But the other thing that we are doing right that I don't see in some jurisdictions is the partnerships like you're seeing today. The partnerships between the public health department and the media, and the partnership between the public health department and our healthcare system. And I want to end on a really neat note. It's through Lynn's advocacy and passion that we have the most amazing community dashboard. And I remember, Lynn, when you brought it to our attention, and really our community bringing forth the talents and the skills. And we have, I think, when we look back to this, an award-winning community dashboard that's transparent, that informs our community on a daily basis. So I think that's what we're doing. That's great. The partnership, the talents, the community, putting everything together so that we can advance together.
Yeah, I would put in a plug to expand that dashboard and continue that into, just there's a whole range. And I know Cottage has been instrumental in providing that public health information, but I think that is so critical for the public. And especially now, like as one of you said, we're all junior virologists. So there is we're interested in this topic. So the more information we have, the better.
We didn't get a chance to even talk about the pioneering work that Lynn and UCSB and Cottage are doing in terms of taking this to the next level.
I'll make it. Thanks, Chuck, and thanks, Vaughn, and thanks to all of you. I should mention that Kurt was actually very instrumental also in the dashboard too, and advising on. My final comment, Bill, is to every single one of my panelists, but also to everyone listening. The curve turning down with the speed that it did only happened because of the commitment that every single person made to protecting themselves, their loved ones, in our community. In public health, we unfortunately only see the failures, and I hate to say it that way, but Vaughn lives this. We don't get to see all the amazing saves that her team makes by avoiding an outbreak in this part of the county or that part of the county with a different infectious disease. What we have seen, and this, Ron described it as the third bump, this was the surge. This was the surge where our community died from this virus. And yet, in this last 3 or 4 weeks, the numbers have plummeted, absolutely plummeted. I'll mention quickly, Chuck alluded to a local variant testing effort that's underway. We can talk about another time. But what I think we're gonna find, my editorial, is that a big part of the Southern California experience with this surge is going to be related to what we find out about the transmissibility of a specific variant that we're finding throughout our region. And so I think, again, lots more to come on that. But the good news is with vaccines, with all of the great efforts that are underway, I'm not scared of that variant. I know that we got this.
Great, thank you. And I appreciate all of that, which reminds me a question that I forgot to ask is about the tiers, the colored tiers. What do you hear about us going to the red tier?
I think that I am hopeful that as our case rates and our testing positivity plummets, as Lynn characterized it, that it will continue. That downward trajectory will continue, and we can move towards the red tier. I update our board of supervisors on Tuesdays about our tier status, and we are hoping to do some projections as well.
Okay, great. Well, I want to thank you guys. This has been a lot of fun for me, and I think it's been really informative to our readers. I would love to do this again because we only scratched a very small fraction of the questions, and there's so many issues out there that we could just do this for hours. But I want to thank our sponsors, Cottage Health, Sansum Clinic, the Santa Barbara Foundation, Santa Barbara Neighborhood Clinics, the Mosher Foundation, the Santa Barbara South Coast Chamber of Commerce, and Santa Barbara County Public Health Department. And thank you to our panelists, Ron Werft, Dr. Lynn Fitzgibbons, Dr. Kurt Ransohoff, Dr. Charles Fenzi, and Dr. Do-Reynoso. As a reminder, the Noozhawk story will be posted later tonight, and it will include an embedded recording of this webinar. We'll also be sending that around to our registrants and sharing it with our sponsors to also make it available to you. And I just want to say thank you very much for your support of Noozhawk. Our readers are the best in the world, and their enthusiasm for what we're doing and especially the enthusiasm from our Hawks Club members has been just a tremendous support for what we're doing. And we do feel like we're making a difference in the community, a positive difference, and we can't do that without all of your support. So thank you very much. Until next time, I'm Bill Macfadyen. Thanks for tuning in.
Thank you, Bill, for putting
Thanks,
this
Bill.
together.
Thanks so much.
Bye-bye.
Goodbye.